Hi moms and dads if you're watching. My name is Dr. Emilie and I'm a chiropractor at Oaktree. And I'm glad you're here, even though I can't see you. We're going to go through some information together, and I'll tell you that I've been passionate about prenatal care, infant care, child care with chiropractic since I was a student. I loved it so much I did all kinds of certifications in that, and I've helped lots of women through their pregnancies, and so I've pretty much seen most scenarios from wellness pregnancies to back pain, hip pain, sciatica, pubic symphysis dysfunction. That's a mouthful, but that's pain in the front of the pubic bone. So there's a lot of different things that can come up in pregnancy. So I just want to tell you that you're in the right place. We know and have seen so many of these things. The other thing I want to mention is I realized that a video is a bit of a different scenario, and it really is different on purpose. Science says the more you understand about your health, the faster you get well and the longer you stay well. And so for us, that's really an effort in that direction to give you even more information about all of the background with all of this that's going on. And so, pregnancies for everybody will be different. I mentioned sometimes we see people for wellness care, and it might be that, their family member or doula or midwife or doctor has said, chiropractic care is good for a better pregnancy, for a easier delivery, which is always a good thing. But a lot of times we meet people because they are in pain. It can be just over time, as your baby is growing, it's putting more stress on your body. And it can be a bit stressful. You might be worried and wonder, is that normal? And you know what? It's not normal, but it is very common. And what I've learned over the years is that depending on the structure of your spine and some of the things that have happened to you before, a lot of the times when we're feeling pain in pregnancy, it can come from problems that were already there. And it basically exacerbates them because there's more relaxin in the ligaments. And so you're really magnifying the problem in essence that was there, whether you were aware of the problem that was there or not. And so these are things that we're going to go into in more depth. And in my own experience with my own babies, like I said, they're all different. So, for one of my pregnancies, the main thing I was dealing with was headaches. And for the other two, after that, it was a lot more back pain. And so I've learned some tricks along the way, and chiropractic care is a huge thing that can help. And so we're going to dig in together. We're going to go through some anatomy, how does the spine function, some nerves, to understand that, how these problems can get there in the first place, what's normal, what's not, even what an x-ray should look like, so you can see the structure of the spine and what it should look like. And then we'll even talk into infants, the birth and infant care, because these babies will be born soon, and then you'll know a little bit more what to expect and what to check for in those cases as well. All right, so let's dig in together. I do ask questions, but it's more to make you just think to yourself, because I know you're by yourself, as we go through this. Now, the first thing to go over is the brain. The brain's the most complex structure in the universe. There's trillions of cells inside your brain just to make your body work. And when you think about it, the brain actually gets a helmet when you're made. Why do we think the brain gets a helmet? If you really think about it, what's the worst kind of damage you can get? Brain damage, right? Because the brain controls everything, and we all know that. It's basic knowledge, but when we really stop to think about it, right now your heart is beating, your lungs are breathing, you're digesting food, you're growing toenails. All this happens because the brain is actually sending signals through the spinal cord out to these nerves for your body to actually be able to function. And so that's common knowledge. Your brain controls everything. The other thing I want to make sure is clear is that your brain also controls all the healing in your body. So for you to heal from anything, whether you just cut yourself to you have a fever or you have long-term degeneration, really for you to heal from anything, again, your brain has to be able to connect to that body part so that it can heal. And so when you come into our office, we analyze your spine. We look at the structure, we look at the function. The structure basically is this here, these three curves from the side, and your spine should be straight from the front. So that's the structure. We also analyze your function. Function talks more about each vertebra should move with the one beside it, and that should give your body this overall range of motion. Now, when everything is functioning properly and it's structured well, your spine should stay healthy and vital. It shouldn't break down or degenerate until you're 80, 90, 100 years old. That would be normal aging at that point. But what happens is our spine doesn't stay looking like this forever. We go through all kinds of different traumas and strains, and and falls and things like that actually change the alignment of our spine over time. So I'm going to go over some of them with you. And we go through your history in a lot of detail when you come in, but one of the things, even just to think about, is your spine's actually supposed to curve like this. Well, we ask you about the birth process because depending how someone's born, it can affect actually the spine right from the beginning. And so something like forceps, vacuum, C-section, even a lot of natural deliveries can cause a lot of stress on the upper neck. So that's one of the first potential traumas there. But then if you look at your whole life, what your body's been through, whether it's learning to walk when you're young, falling down the stairs, sports or activities are a big one. So if you think about, there's obvious ones, you play rugby or football, you get checked, or hockey, you could see how the spine could shift. There's other ones that might seem more gentle, like ballet or something like that. But really, if you're doing the same motion over and over and over, it affects the actual alignment of the spine. So growing up, it can have a huge impact on how the spine develops. So that's that. And then you can think about, if you ever had ski falls, bike falls, car accidents, these things all basically pile up through your life and end up putting your spine in a position that is not necessarily optimal, like is here. And I would say one of the biggest things that we see is people whose head is too far forward, like this. Think to yourself, what do you think causes that? What causes us to do this all the time? So there's computers for sure, sitting at our computer desk. There's, driving forces us to sit like this, video games, that kind of stuff. But one of the biggest culprits now is our phones or our tablets, right? Instead of looking forward, we're even looking down more than that. So why is that such a big deal? If you look at the spine, normally it's curving like this. So I'll keep using the neck as the example. If the neck's forward like this, what it does is it actually doesn't absorb shock how it's supposed to. So again, if you look at this picture here, there's the 3 curves on the side. They actually absorb shock. So every time you take a step or you're doing a sport, you're actually absorbing shock as you go through. If you look at me here, if my spine is forward like this, and then I'm doing things, well, all the pressure is not going down my spine anymore, it's going here. And so it'll actually start to break down the spine faster than it should. So in between the vertebrae, there's these discs. Those are the spaces here and here. So they'll actually start to break down. If you've heard of the term degenerative disc disease, degenerative joint disease, those are fancy words for arthritis, which is wear and tear and breakdown of the spine and the joints itself. And so that normally doesn't happen until someone is elderly, but it can happen a lot faster if the spine's been out of alignment for so long. And that could happen in the neck this way. It could be the spine sideways, breaking down in the lower back, whichever way. Now, that's to do with the spine itself, but the other thing that happens is as soon as the spine goes out of alignment, it actually stretches the spinal cord inside. So if you think back for a minute, the brain sends absolutely every single signal to your body through the spinal cord. If the spinal cord gets stretched inside, how do you think your body's functioning? It's not functioning as well as it should. And that's really where we come in and we will analyze your spine to look at the position to see, is there stress on the nerves? Is there stress on the spinal cord? To see how it all connects. I hope that makes sense. Now, the other thing that we'd like to go over, and it's important to understand for your own body, is that depending where in your spine there are misalignments or stress in the nervous system, it actually affects different areas of your body. And it's important to understand that. So if there's actual subluxation, which is that stress in the nerve in the upper neck here, those nerves go back up into the eyes, ears, nose, throat, head, brain, so that whole area at the top there. So it can actually affect your vision, it can cause sinus congestion that never goes away, ear infections in kids, vertigo, balance problems. It can affect mood disorders as those nerves go up into the brain as well, your hormone centers in the brain here. So there's huge connections with whatever's going on more in the upper neck. In terms of the next part of the spine, it's the lower neck. So the nerves here, they actually go across your shoulders and then they go down your arms. And so it can cause pain into your shoulders or that tension that never goes away, and then down into your hands. So it can cause tingling or numbness going down into the hands as well. And then the nerves also, the same ones that start in your lower shoulders and neck, go over to the heart and the lungs on the inside. And so it can actually affect how those organs function if there's an improper communication from the brain to those organs. So it could show up as breathing difficulties, heart difficulties, palpitations, arrhythmias, that kind of stuff can show up there. The next portion here is the middle back. So that's basically between the lower neck here and where you start the lower back. So your whole torso would be in that section there. And a big part of the organs there are the digestive organs. And so if there's interference in how those nerves are communicating, a lot of times we see things show up like irritable bowel syndrome, indigestion, heartburn, that kind of thing. And then if it's affecting more in the back, then you see it more in terms of pain. So it might be muscle soreness, rib pain, shoulder issues, back pain, that kind of thing. The last portion is the lower back. So that's going down into here. And I'll just stand up so you can see it on me. Basically, the nerves are in the middle here, and then they split and go down your legs. And so that can for sure cause back pain, but also those nerves go down the legs. So if you've heard of sciatica before, it can be a sharp shooting pain down the legs. It can be numbing or tingling going down the legs, and that can show up from an issue in the lower back. There's also something called restless leg syndrome that often shows up when there's subluxation in the lower back there. The other thing is that those nerves, then they go and control all the organs connected on the inside. And so in terms of that, it can affect the large intestine, can affect the bladder, the reproductive cycle as well, and any other organs that are in that area connect to those nerves. So I know that's a lot of information, but I hope it helps understand all the connections that we have. We all have those connections in our body, and we want to make sure that everything is as aligned as possible so your body has that optimal chance to function and to heal as well as it can. So I want to explain a little bit more about the pelvis, the sacrum, and how it all fits in with pregnancy, because now you know how the actual shape is supposed to look. And so basically, your pelvis has the two pelvic bones, and there's a sacrum at the back, so you'll see a picture there. And then what happens is that at the front, two parts of the pelvis meet, and that makes the pubic symphysis joint right there. And so in pregnancy, it's normal, as your belly grows, it's actually going to rock forward, the pelvis. And then what happens is it puts a tremendous amount of pressure on the pubic symphysis. And so that's why it could show up with pain there. But the other thing is it pulls from the back, and so that can cause pain between the sacrum and the pelvis, and that's the sacroiliac joint, or if you've heard of the SI joint before. It can also pull on the nerves back there and cause sciatica, which goes down the leg. And so that, in the sense of what's normal, what's not, it's normal for the pelvis to rock forward. And the other thing though, is that sometimes it will actually, one part of the pelvis tilt forward, one part goes backwards, and it causes more of a torque. And so it's more of an uneven pressure, and that can affect the ligaments that are inside and how it pulls on the uterus. Another thing that can happen in that case is that if your hips weren't even level in the first place, or you had a scoliosis or something like that before, that will even cause torque in itself. And so when that happens, it can pull on the uterus inside, and it can make less room inside. And so it can lead to malposition of the baby, if you've heard of breech before, which is baby's bum down instead of head down. And that can start to be a concern when we start to look at position around 33, 34 weeks. It is important for us to know, because then we can check even more of those ligaments to make sure the baby's in the right position, or we can help the baby move towards the right position. Not necessarily by us turning the baby, but basically we're making sure that there's enough room in the pelvis, that the joints are moving properly, the ligaments are released, so that it can go back to the right position itself. So I'm going to tell you about one of my patients, Georgina. It helps to put all of this stuff we're learning together. She actually came into the office, she was 7 years old, and she was using a walker. And I remember going through her history with her and asking her, well, how long have you had low back pain? And you could probably imagine someone who's 70 with a walker. She said it'd been years and years. She was like, it's been like 30, 40 years that I've had back pain. But what she said was it wasn't a big deal 30, 40 years ago. Right, so she'd have back pain once in a while, put a hot pack or something on her back, and she'd be fine. Then though, it would increase. So a few times a year she'd have it so severe she'd go see her doctor, get painkillers, something like that, and dealt with it through the years that way. But when you look at her now, it's not like this lady went to bed one night and she could walk, and then she wakes up the next day and she needs a walker. Like, it doesn't happen that fast. She actually, when we went through it, she said she used to run when she was in her 20s, and that was not a problem for her back. Well, then it became harder, so she started just walking, and then eventually walking was hard with time, so she got a cane, and then eventually she got the walker. So, this is a very gradual process over time. And, she had an issue in her low back here, and it was affecting basically the function of her legs as well. And the thing is that it didn't only affect that, because what we just went through, how the nerves connect to all the different body parts, when she checked off on her form, one of the other major issues she had was digestive trouble. So it turns out she had constipation, and when she had constipation, she would take laxatives. Well, then she would get diarrhea, and then she would take antidiarrheals, which is just not a way that, normally your digestive system is supposed to work. So it wasn't working properly. And when we really look at the big picture of it in context with how all the nerves connect, we look at it and we look and say, what, is the large intestine even properly connecting back to the brain, right? So the large intestine here, is it getting disconnected from the brain? And that's what's affecting that. And so the other major thing that we went through in her history was she had bladder difficulty. And if you have to imagine, again, someone who's 7 years old with bladder difficulty, what do you think that she's wearing? No one really wants to go there, but she's wearing Depends, so adult diapers. And really how the bladder is supposed to work, if I was to drink a whole big glass of water right before bed, I would wake up in the middle of the night to go to the washroom. Because what happens is you have your bladder and it basically fills up to a certain point, and then it sends a message up to your brain and your brain wakes you up. That's how it normally functions, right? So for her bladder's filling up, it sends a message to her brain, but it gets disconnected at the level of the low back, where all those troubles are going on. So she has no awareness that she has to go. So the other thing we talked about that's connected with the same area is I asked her about the history of her cycle. The same nerves in the low back, they supply the whole reproductive cycle. And it turns out she actually doesn't even have a uterus anymore. And I was like, what do you mean you don't have a uterus anymore? And she basically said she had trouble with it her whole life. So eventually she had it removed after she had had kids, because she just had too much trouble with it. And so I asked her a little bit more, the history of her cycle, when did it start, how long has she had it, and she said it was way back, like she could remember it when she was late teens, early 20s. Every month she'd have her cycle, she'd have back pain going down into her bum, and she just thought it was normal, so she never did anything about it, but that was another sign that there was a problem. And I'll tell you, it's not normal, it can be common though. So Georgina ended up actually, getting adjusted, and she improved, which was so good. She wasn't in a good place to start, but even starting to take pressure off of the nerves by moving her spine, it led to the fact that she had less pain in her low back fairly quickly, which was really nice to see. And then a few months down the road, she went from using her walker and not being able to even walk to the clinic, even though she lived about 8 blocks away, to walking to the clinic, which is a huge improvement. And a couple months later, it's amazing, but she actually started biking to the clinic, which blew our minds. But it was so nice to see because, when someone is 7 years old or aging, we just expect them to get worse and worse and worse. I don't, but, society does, and that's kind of what the normal is. You never see someone go backwards and get better mobility. It's always the other way around. And so for us, we would say it's never too late to get checked and see if there's something that can be done with chiropractic care. Next, we're going to go into some pictures and x-rays so you can see what does this actually look like on the inside. Now, in pregnancy, we don't have x-rays. We have a picture of your posture, which gives us an idea of what's going on the inside. And we do have other tests, of course, to put all together. But what we would expect in the picture is we want to see normally a spine that's centered from the front. And from the side, there's a certain line it should follow. So here's a picture of someone who's pregnant. And you can see the green line goes straight down the center. And if there's a deviation in this situation, so the red line is where your body is, that shows us that there was likely an imbalance there in the first place. The side-to-side imbalances don't usually show up in pregnancy. It can get worse in pregnancy for sure. We also check the weight distribution to see what's going on there. Now from the side, in this picture, the green line should go through your ear, your shoulder, your hip, your knee, and then your ankle. So that would be the normal line, and the red line is where you are. Now, it is normal in pregnancy that we'll see that hip line move forward. Depending how far along you are in your pregnancy. And therefore it affects the mid, back, and the neck going up as well. But this will help us give us an idea, is it normal how much off that you are depending on your stage of pregnancy, and how it is affecting you above as well. So it's important for us to see those together. So next I want to go through a few x-rays with you so you can see what does this actually look like. So the first x-ray is the x-ray of the low back. So you're looking at the person from behind, and you can see the hips on the sides and the spine is straight in the middle. So that's how it normally should look like. The squares that you see are the vertebrae, and the spaces between are the discs. Now the spinal cord runs right in the middle of that, so that's a healthy, good looking lower back. What do you see on this one? Should be pretty obvious. You can see it's way off in terms of the curve. So again, normally it's supposed to be straight, but this spine has a curve in it, which is actually called a scoliosis in this particular case. If you look at the hips, you can see that one is actually lower than the other, and you can see that the spine curves into that side. Now if you look closely at the actual bones, they're supposed to be rectangular, but there's all kinds of points on them at that side that's squished inside, and the disc spaces are really thin there, even though they're thick on the other side. So that's literally crushing one side of the spine. Now remember, what do we really care about when we look at an x-ray is what's happening to the nerves and the nervous system. So how do you think the spinal cord is doing in that x-ray? Can't be good, right? So there's pressure on that whole spinal cord, and it's stretching that, and every space there's nerves that come out, they're getting crushed where they come out there. And this is an x-ray of the lower back, and so the last three ones that come out, they actually come together and go down the leg and make the sciatic nerve. And so in this case, it's a lower back. If anybody that's watching this, you have an issue with your low back, basically it's going to affect anything from those levels down from there. I have a few more examples of the neck, because if there's an issue up in the neck, guess what it affects? It's anything, right? Because for the brain to get signals through anywhere, it has to go through your neck first before it can make its way down or even up into the head. So by default, the neck is the most important area of your spine. So the first x-ray I have to show you is a normal x-ray. So it should be a C-shaped curve if you remember those three curves from the side. And again, the vertebrae are nice and square and the spaces between are nice and big. So that's a normal spine for the neck. This is a spine that's too far forward. So you should be able to see there's the red line where the person is and yellow where you should be. So we'll always put those lines so you can understand your x-rays more. So this person is basically the head forward, like we've talked about. The only thing that is even worse, I would say, with this x-ray is this person's only 3 years old, which is not good. I mean, if an adult has a spine with that much difference from the yellow to the red, I would be very concerned, but at 3 it's even worse. And so the history with this girl here is that she actually came to the clinic because she had really bad asthma, and her parents had her on puffers and Ventolin, all the stuff that you normally do for asthma, but she was still having really serious asthma attacks that weren't all controllable through those meds. And so they started asking people, well, what else can we do for asthma outside the box? What do you know? And someone told them you should go see a chiropractor for her breathing. And her parents were like, why would we do that? Like, how is that even connected? But they were pretty desperate to find an answer for her, so they brought her in. And basically I checked Emma's spine, and basically the first vertebra was severely shifted in the top. And that gave me enough reason to take an x-ray and see what was going on. And I'm really thankful that I did, because it was really off, again, like I said, for her age. Now, just from what you know so far, from what we've talked about, does it make sense to you that that kind of blockage in the upper neck could affect her breathing? Think about it. It could. And I know that probably wouldn't make sense 20 minutes ago, right? But it absolutely could affect the lungs. And so we talked with her parents, and I explained to them, as chiropractors, we're not lung doctors. That's not what we do. We really are specialists with the nervous system, with the spine. And we talked about that. If her spine was in better alignment, how much easier would her body be able to function? How much easier would her body be able to heal? We've often seen breathing improve in children, but it's still not necessarily a guarantee. But thankfully they were like, we have to do something, let's at least get her health on track. They started coming in, and all along our focus is to clear her nervous system. And we're working on getting her spine as close to the normal alignment as possible. And it was wonderful to see, because her breathing did improve the more that we cleared those subluxations in her neck. And eventually we actually took a follow-up x-ray of her 12 months later, so quite a bit later. By then her breathing had improved so much she wasn't on any medication, which was really nice. But her new x-ray, if you look at it here, looks great. And you know, the amazing thing is when you look at how her body is working a lot better, it really has to do, again, like we talked about, with the fact that her brain can now properly communicate to her lungs, right? So her lungs actually healed because her body had better function through that area. And another side note too is that she was sick a lot, antibiotics a lot. Her immune system wasn't very strong, as you can imagine, if there's big interference in up here, and that improved dramatically as well. So it was wonderful to see that in her case, that she improved so much. Now, if you look at this slide, it says phase 1. And the reason it does is if you look at her x-ray, and it's clear on the second x-ray, the vertebrae are nice and square and the spaces between are really thick. So that's called phase 1 because her spine was originally out of the normal alignment, but there was no damage in the actual bones themselves. If her spine was forward, so we talked about if the neck's forward for long enough and there's pressure, eventually it will start to break down. And it takes about 10, 15, 20 years to do that. So in her case at 3, if no one had ever worked on her spine, and we met her when she was 13 or 15 or 18, we would see that her spine had degenerated. And so what that would look like, this is a phase 2 x-ray that you see next. And we've put arrows so you can see where parts of the actual bones are sharper and more white, especially in the back, and that actually compresses into the spinal cord itself, which obviously we do not want. So that would be phase 2. Now, if the spine's not even worked on in a phase 2, eventually, again, because it's out of alignment, more and more compression happens, and so the spaces between the vertebrae, they actually get smaller, so the discs get compressed. And that would be phase 3. And so the example we have to show you here, you'll see that the disc spaces are smaller and smaller, which is phase 3 there. Eventually, as you can probably imagine, we've gone through phase 1, 2, 3. If nothing is done to the spine, eventually it moves on to phase 4, which is basically fusion. So those two vertebrae get so close together that they fuse. And by phase 4, there's nothing we can really do to undo that. Not as chiropractors anyway, we can't unfuse the spine. And so at that point, it would be too late to really do anything. All right, so we have one more case to show you, and it starts with a quiz. I can't hear your answer, but first, look at this x-ray and tell yourself what phase do you think this person is in, based on what we learned so far. A lot of the times, people say phase 2 or 3. It is phase 2, and how you would know, as soon as you're off of the normal line, you're at least phase 1. So if the yellow line and the red line don't match, you're phase 1. Phase 2 would be if at the front of the spine it's more pointy and sharp, and at the back as well. And then phase 3 would be if the discs are compressed. And right now the discs are still wide open. And so this person's in a phase 2, but it looks really bad because it's going in the complete opposite direction from what it should be. And so this person basically deals with headaches. She's got neck pain, low back pain. She also has seasonal allergies. And she basically takes Advil most days for her headaches, sometimes for her back. She takes Claritin every day for her allergies as well. So she's not in great shape. But one of the interesting things is that she has been seeing a chiropractor for the last 10 years. And basically, every time she has a more severe headache or her back's really bad, she'll call and she'll go get an adjustment. And so she's really using it as another form of pain relief on top of taking, the painkillers that she takes. And she's been doing that for years and is happy that it's another natural way to deal with her pain by going to see her chiropractor. But what happened was that she actually moved towns, and so she found a new chiropractor. And the new chiropractor took an x-ray, and he's the one that took this x-ray. And he told her, your spine is going in the opposite direction. You're in phase 2. No wonder you're dealing with headaches, back pain, and all this stuff. We need to correct this. And she basically just knew chiropractic as she knew it and fell into the same pattern that she was doing with the first chiropractor. So she just went whenever her pain was really bad, her headache was more intense, and she got adjusted, and it would help her get through that moment kind of thing. She did this for years. And eventually, as chiropractic was part of her life, she moved again and found a new chiropractor. And so she hadn't had an x-ray in 12 years from that other one, and they took a new x-ray at the new office, and this is what it looked like. So here's the first one and the second one side by side. Now, if you look at it closely, you can see that there's a kink going into the wrong direction at the bottom. it's getting worse. And if you look at the bones at the front, especially at the bottom, they're more sharp and pointy than they were on the first one. So you can see that the spine is actually getting worse, even though she's been getting some care. And so this chiropractor explained to her it's still phase 2, it's just more advanced. But if you want it to get better, you can't keep doing what you were doing before, right? He explained to her going just for pain isn't going to correct your alignment. And so he recommended that if she wanted to correct it, she come a lot more frequently than she was used to. So he recommended that she come 3 times a week to start. 3 times a week. And that sounds like a lot, and we're going to recommend that to a lot of people that start with us. And one of the reasons is that if you get adjusted on your first visit, by the time you get home that night or the next day, guess what happens to the spine? It goes back. And the reason it does is we have all kinds of muscles and ligaments that have been holding our spine in a certain position for so long that if we adjust the spine, it'll fall back. And then we'll adjust again and it'll fall back. And eventually it starts to hold better and better and better. And so in her case, because of the severity of her spine, they recommended 3 times a week. And she did that. She decided to do it and actually correct this problem because she could see that it was getting worse, and she still had all the same symptoms all these years. And so they adjusted her 3 times a week for 3 months, 2 times a week for 3 months, and then they took another x-ray to see, okay, well, is it on the right track? And you can see on here that now the curve is starting to take its normal shape. And then 6 months later, she had been going for once a week. And then here you are, it's in the right curve at the bottom, which is amazing to see. And so from when she started with this new chiropractor to this most recent x-ray, it was a year of actually working on the correction of the spine. And at that point, her headaches were gone. She didn't take Advil anymore. Her neck pain was much better. Once in a while she had some. Her allergies were gone. She didn't have to take Claritin anymore. And her low back pain was about 50% better. They actually diagnosed a scoliosis in her low back and are dealing with that as well. But huge improvements in her life, in her function, in her healing, all around, which is amazing. And if you look at this, it's not the perfect alignment yet, but they got to the best alignment they could a few years later here. So you can see the last one. And it's almost perfect. There is damage. If you look closely, there's damage in the lower neck. Between C5 and C6, that disc is smaller, and that's where the curve was going in the wrong direction for all of those years. So there is more damage there, unfortunately. But it does highlight really the approach we take with chiropractic care. Our approach isn't necessarily just to deal with the pain in the moment. That's what was happening before for her. Our goal is really to get as much correction as we can in the spine and really get to the underlying cause of why those symptoms are there in the first place. And so if you look at this whole thing, it's called spinal reconstruction, where we take the spine from where it is and bring it to the best alignment we can. It doesn't mean it's going to get back to perfect in everybody's case, but we always want to be working towards that direction, because otherwise we know it's going the other way. There's so many forces pulling against us: gravity, stress, all the things that happen in our life, our position at work, posture, and so we always want to be moving in the proper direction. And one of the reasons that specifically I went into this type of care and that we do this with Oaktree is that this case that I've just shown you is actually my spine. I'm very proud of it now. But that was my story. I've been a chiropractic patient for years, and I loved it. I loved the whole time, but I didn't even know that there was something that could be done to correct the underlying issue. I thought it was just a way to help me feel better as I would go through my life. And so now that my spine's corrected, it's at the best alignment it can. I mean, I can do so many things that I couldn't do before. And I still don't deal with headaches, back pain, neck pain, allergies. It's still all gone. But now I can be active and do triathlons and bike and run and race and do all kinds of things that are great that there's no way I'd be able to do if my spine was still what it was like way back before. And that's really what we want for you. We want you to be at your best. And I'll back up for a minute too and tell you, once I learned all of this, I looked into it a bit more, because for the first x-ray I showed you, where you guys saw that I was in phase 2, my spine's going the wrong way, I was actually only 14 years old. And how long does it take to even cause arthritis in the spine? At 14, there was already evidence of early degeneration. So if we back up, it usually takes 10 to 15 years. When did my problem start? Likely birth, or close to it, for that amount of degeneration to line up that way. So I was born by C-section, and I used to think they would just cut the mom open and take the baby out. but it's a smaller hole than that, and so, you know, I'm happy they did it, but they could have pulled me out by my head, my arm, I don't know, but that could have definitely caused some damage in the upper neck. The other thing that was definitely related was when I was young, we had one of those walkers. Those are the things that when you're a baby you sit in, but it rolls everywhere. They don't make them anymore, they're outlawed, but I was in one of those and I fell down the stairs into the basement inside that, and I hit my head at the bottom. And my parents brought me to the hospital, like, as you can imagine, and I was fine on the outside, but you know, kids, all of these things that they do and we do is we fall, you get back up, you bounce back, you're like rubber. But if my spine actually hit this way, that would be enough pressure that my spine would have kept growing in the wrong direction. Even if they x-rayed me that day, they wouldn't have seen it necessarily because it's ligament damage. And so over the years, my spine kept growing that way unbeknownst to anybody until my first x-ray at 14. And so that's one of the reasons that we see so many kids in our office. And if you come and you're there and you see families and kids and babies, you might be like, do they all have back pain? What's going on? But it's not that. Some of them for sure come in with specific issues we're trying to work through, but a lot of people come in and it's really prevention. You know, kids are so active, and some of the stuff you're dealing with today, if you're an adult watching this, it started when you were young and it got piled on and piled on and piled on, and now you're dealing with it. And so when we see kids, we're really trying to deal with things as they happen, so we don't end up with an issue of 20 years of damage in the spine, if that makes sense. Okay, so I'm just going to go through a couple more logistics. You might be wondering what phase you're in, how often do you have to come, how long does it take, and everything. So I hope it makes sense that, you know, if it took your spine 5, 10, 25 years to get into the position that it is, it's not something that is a quick fix. You know, it takes time and energy to correct the spine. And so big picture, you know, someone in phase 1, a child or a young adult, could take a year and a half to get to the best correction. If you're in phase 2, it can take sometimes 2, 3, 4 years to get to the best correction possible. And it doesn't necessarily mean that you're coming 3 times a week for 4 years. No, that's not the case. But it just means that the spine is still correcting, it's still not at its best position, and eventually it gets to the best position possible. And so usually for most adults, we'll recommend that we start with a care plan of 3 months, or sometimes 6 months, and then we reevaluate along the way to see where we're going. In pregnancy, it's a little bit different. We can go 2 different ways. One way is that we start with spinal correction right away. An adult 20 to 40 years old is usually in phase 2 from our experience. It could be earlier or later in phase 2, but we have an idea from that, and then we put that together with all your test results, and we can put together an action plan to start working on right away some of the spinal correction, plus working on the pelvis and all the alignment for the pregnancy and the birth as well. So that's one option, and in that case, a lot of times it is starting with more 3 times a week and going down from there in frequency. And then what would happen is once the baby is born, there's another window of about 6 weeks, and the whole time you have relaxin in your body, you still have some for the next 6 weeks. And so if you've ever heard moms say, you know, the thing of like, oh, after I had my baby, my hips were never the same kind of thing. And so we can use that window to get you back to normal, which is a really important time. After that, the 6 weeks, we usually would take x-rays there, and then we can see what exactly is going on, what did we not know or confirm, and give you more specific exercises and adjustments based on the structure. And so the advantage of already working on spinal correction while you're pregnant is because you have more relaxin, we can get more change and more movement because your body's letting us do that. There's less resistance. So that is one approach we can do. Another approach in pregnancy can be to work on the pregnancy itself. And so in that case, it would be really working on the pelvis. We can work on the whole spine still, but the goal is to make sure everything is moving properly for the birth and everything is going in that direction. And so in that case, we often start twice a week and eventually once a week. And we would stay once a week usually until the birth, unless some kind of new issue were to arise, then we could modify if needed from there. And so, so those are the 2 different approaches. We can take it basically from a long-term perspective of actually working on spinal correction right away, or work on the pregnancy itself. But if we do that, we can still adjust you after the baby's born and still take x-rays at the 6-week mark, and then figure out from there if it's something that you want to pursue in terms of more correction. So really it can be looked at both ways. And you know, from watching this video, you probably have a good idea that, you know, I'm pretty passionate about this, and you know, if you were to ask me, do you think that you should take care of your spine for your whole life? You know, I would say yes. right? But at this moment, we're just getting started. That's not necessarily the conversation, right? You might be in bad shape and we need to get you back to normal. We might need to stabilize things before we ever get to that conversation. But in our office, probably about 75% of people are on wellness care. They keep doing it to stay healthy, to be well. They like what that feels like. And so that's usually where care can transition afterwards. Now, the other thing is that there can be some challenges with starting care or some questions. Number one, we often get the question, is it safe for the baby to get adjusted when you're pregnant? Absolutely. I'm happy to say it's gentle and effective for the mom and the baby, so it's very safe for that. Another common question would be, does it hurt to get adjusted? Most of the time it does not hurt. In some cases it can be sore, but that's more almost like an exercise. So if you work out and you're sore the next day, it's muscle soreness. It can be similar to that, because if we're adjusting things in your pelvis, or even if we're working higher up, the muscles have to change position and they have to adapt to the new alignment. And so it can be sore, usually the first couple weeks if it's going to happen. Keep us posted, it's always temporary. So as long as we know about it, we can go through that with you. And so that's another common question. Something else that could come up is you could be watching this and maybe we don't resonate with you, or our approach doesn't resonate with you, and you know what? If it doesn't, just let us know. We won't be offended. We love what we do and we love our approach, but I understand that it might not be for everybody. So at the end of the day, we want what's best for you. It's important to take care of your spine, to get adjusted while you're pregnant. And so if we can find another office for you, we've been doing this long enough that we know most other offices who focus on pregnancy care as well, so we can always send you in the right direction. And that would apply as well for if there's someone you know that could use this information, then we can also maybe find someone in another town for them as well to get some care. So we'd be happy to do that if we can. Now, I would love to share so much more with you, but you've been patiently listening this whole time. We do have a lot more resources, videos, books, handouts, all kinds of stuff at the clinic. And I'm a resource as well if you want to ask any questions. I've seen a lot, like I mentioned, through our patients, but I've also been through a lot myself. I've had 3 kids, and one was born in the hospital, 2 were born at home. One was 3 weeks overdue from his due date. The other 2 were 2 weeks later, so I know all about induction, the natural ways of induction and all of that. What else? One was breech. The first one was breech in the beginning, so dealt with all of that. I had milk issues afterwards, like supply issues. I know all about nursing. So what I want to say is that everybody has a different journey, but there's always something we can learn from it, and there's always something we can share. And if we can help other people have a better approach at it, then that's huge. And I mean, this has been more focused on pregnancy. There's so much information once the baby's born as well that we're happy to share, and even protecting baby's spine, making sure things are done well along the way for them as well. So hopefully this information's been helpful. And when we see each other next, then we'll sit down and go through your results in more detail and figure out basically what your action plan will be. All right, have a good day.